Proteinuria happens when there's too much protein in the urine, which isn't ideal because our kidneys are like filters. They let extra salts and fluids pass through but keep important proteins. Now let's talk about creatinine levels. Creatinine is a waste product from muscles when we move or do stuff. Usually our kidneys filter it out. The amount of protein in urine and creatinine in the blood can tell us a lot about kidney health. When kidneys are not doing well, they might struggle to filter creatinine, making its level in the blood go up. Also, damaged kidneys might leak protein into the urine, causing proteinuria. So, what are the signs? One common thing is foamy urine, showing there's too much protein hanging out where it shouldn't. If you notice this, it's a good idea to check in with a healthcare professional to keep tabs on your kidney health. Swelling, especially in the hands, feet, or face, which is known as edema, can occur when your kidneys, responsible for regulating fluid balance, are damaged. If the kidneys are not functioning well, you might experience fatigue, weakness, and an overall feeling of being unwell. This happens because your body may lack essential amino acids from proteins. Proteinuria, which indicates kidney damage, can also manifest as high blood pressure. Damaged kidneys struggle to regulate fluid levels, leading to an increase in salts and water in your body, potentially raising blood pressure. High blood pressure, in turn, becomes a significant risk factor for kidney disease, creating a harmful cycle of damage. The impact of protein on the kidneys should not be underestimated. Continuous protein leakage can contribute to inflammation and scarring of renal tissue, impairing the kidney's ability to effectively filter blood. Over time, this damage can progress to chronic kidney disease, a severe condition that may eventually result in kidney failure. It's essential to be aware of these signs and take steps to protect your kidney health. Ever heard about a vitamin that works wonders in treating proteinuria fast? If not, you're in for a treat. Today we're diving into some fantastic remedies, vitamins and tips to quickly tackle proteinuria. First up, the superhero of the vitamin world, vitamin D. Did you know that low levels of vitamin D can lead to fatigue, weak bones and muscle issues, not to mention a faster decline in overall kidney health? On the flip side, getting your daily dose of vitamin D, either through natural sources or supplements, has proven to be a game changer in relieving and treating proteinuria. Research even tells us that vitamin D deficiency is pretty common among folks dealing with proteinuria, chronic kidney disease, or kidney damage. A study in 2017 revealed that a whopping 30 to 70% of patients with chronic kidney disease had lower than ideal levels of vitamin D. And here's the kicker, a meta-analysis in 2019, looking at 12 studies, found that vitamin D supplementation significantly slashed proteinuria in patients with chronic kidney disease. How cool is that? Stay with us as we unravel more tips and tricks to keep your kidneys happy and healthy. Ready for the next nugget of wisdom? Let's keep this journey rolling. Vitamin D is like a helper for calcium. It makes sure our body absorbs enough calcium from food. Calcium is super important for our kidneys, helping them work properly. Vitamin D also has this cool ability to fight inflammation in our body, even in our kidneys. Some smart studies say that taking vitamin D in the right amount can quickly reduce a thing called proteinuria. Experts suggest around 25 micrograms of vitamin D every day, but remember, it's not a one-size-fits-all. Your doctor is the best person to figure out how much you need based on your health. Here's a twist. Even if you eat foods or take vitamin D pills, there's a sneaky mineral that helps vitamin D do its job. We'll uncover more about it, so keep hanging around. Now, let's talk about another friend, vitamin K2. Just like vitamin D, it's on a mission for our bones and other body stuff. Let's talk about something really important. Keeping our bodies healthy, especially our bones and kidneys. Now imagine this. Without enough vitamin K2, calcium might end up in places it shouldn't be, like your blood vessels or kidneys. That's not good news because it could lead to calcification, a fancy word for too much calcium in your blood vessels. This can cause problems like stiff arteries, high blood pressure, and even harm your kidneys. But here's a solution. When you take vitamin K2 along with vitamin D, it guides the calcium to the right places, like your bones, while making sure it doesn't build up where it shouldn't. It's like a tag team ensuring calcium goes where it's needed most. So if you already have high calcium levels or some kidney concerns, adding vitamin K2 to your routine might be a clever move. Raw mushrooms might help keep the outer layer of nephrons safe, preventing them from absorbing too much. This protection can treat proteinuria and reverse kidney damage. You can find raw mushrooms in different forms like extracts, powders, or supplements. It's generally recommended to take between 750 and 100 mg per day. But always check with your healthcare expert for the right dose based on your needs. Number 4, angiotensin receptor blockers, ARBs, are often used for things like high blood pressure, heart failure, and kidney problems. They work by stopping a hormone called angiotensin II, which usually makes blood vessels narrow, causing high blood pressure. By blocking it, ARBs help blood vessels relax, lowering blood pressure. This also eases pressure in the kidneys, reducing protein leakage into the urine. Number 5, magnesium deficiency is common in people with kidney diseases. Now, let's shift gears a bit and talk about a natural remedy, raya mushrooms. They might not be vitamins, but they're like superheroes for your kidneys. These mushrooms contain special compounds that can do wonders for the tiny filtration units in your kidneys, called nephrons. Research from 2018 tells us that raya mushroom extract significantly reduced protein levels in patients with a kidney condition called IgA nephropathy. Another study in 2019 found that raya mushroom extract improved kidney function in folks dealing with chronic kidney disease. How? By reducing inflammation and protecting those precious kidney cells from damage. These mushrooms are like bodyguards for your kidneys, with antioxidant and anti-inflammatory powers. They help neutralize harmful free radicals that could otherwise cause trouble and inflammation in your kidneys. So, adding raya mushrooms to your diet could be a tasty and smart way to give your kidneys some extra love. Remember, keeping it simple and taking care of our bodies doesn't have to be complicated. It can be as easy as including the right vitamins and natural remedies in our daily routine. When your body doesn't have sufficient magnesium, it can impact how vitamin D functions. Studies indicate that around 75% of kidney patients face challenges storing and effectively using vitamin D when there's a magnesium deficiency. This happens because magnesium plays a crucial role in converting vitamin D into citral, the form of vitamin D that interacts with vitamin D receptors and brings about its biological effects. The absence of enough magnesium hinders the conversion of vitamin D into citral, reducing the activity of vitamin D in the body. But that's not all. Magnesium also helps in the absorption of vitamin D from the intestines into the bloodstream. Maintaining adequate magnesium levels is key to ensuring your body absorbs enough vitamin D from the foods or supplements you consume. To meet your magnesium needs, aim for a daily intake of 400 to 420 milligrams if you're an adult man and 310 to 320 milligrams if you're an adult woman. You can find magnesium in leafy green vegetables, nuts, seeds, and whole grains. If needed, you can also consider magnesium supplements under the guidance of your healthcare expert. Remember to show your support by liking this video and subscribing to our channel. We're on a mission to help enhance your health. Thanks for watching, and stay tuned for our next video.